I'm Charles English, President and CEO of the Boys and Girls Club of Greater Dallas. And thank you for joining us as we present a discussion designed to support families and their mental well-being during the COVID-19 pandemic. As cases continue to rise, we are not only concerned for our physical well-being, but also for the mental challenges that are present for many of our youth and the caregivers that the support they give. We thank our partner, OK to Say, for helping to bring together our panel of experts to share resources and knowledge on how to best navigate these challenging times. As a leader in the youth development, please know that Boys and Girls Club of Greater Dallas is here to support the whole child, which includes supporting and educating our families and the community. Again, thank you for joining us. Visit our website at bgcdallas.org to learn more about our mission and how we can support our Dallas youth.
Thank you, Charles. And I'm Crystal Smart, the Vice President of Education for the Boys and Girls Clubs of Greater Dallas. And just a quick echo of your thoughts. We are delighted to bring together members of the BGCD community, the Dallas community, and the OK to Say community to discuss the many challenges of COVID-19 as it relates to mental health and well-being. As parents, caregivers, and caring adults, we're not only juggling many things in the short term, but now it's moved to the long term as we've been through this pandemic going on for 9 months. And so as we juggle things such as school closings and reopenings, working from home, school from home, concerns with and anxiety for one's own physical health as well as others, we want to ground this conversation today in identifying the top or the key issues that are around mental health and the ways that we can actually address them. And so with that, I am excited to introduce our panel that we are so grateful for them for agreeing to convene and have this conversation with our community today. And so our first panelist is Stephanie Rubin, the CEO of Texans Care for Children. Rubin is a nonprofit leader and seasoned policy expert with a record of success in designing and managing policy initiatives at the state and local level. She has worked with some of the nation's leading foundations and nonprofits on early education, public health, child abuse prevention, after school, and criminal justice issues. Sue Shell, the Vice President and Clinical Director of Behavioral Health with the Children's Health Systems of Texas. Shell developed and implemented the Teen Recovery Program, which treats adolescents with both mental and substance abuse issues in a unique clinical model, specifically focused on the needs of adolescents. In her current role, Sue works towards extending behavioral health services into our community, focusing on early identification of treatment needs and preventive care. And Dr. Stormy Williams, who is the Vice President and Medical Director of Network Development with the Children's Health System of Texas. Dr. Williams began her career as a board-certified pediatrician in federally qualified and community health clinics serving underserved populations. In her current role, she provides clinical oversight to the many virtual health programs within the health system and serves as the clinical leader within the Children's Healthcare Network, helping to foster alignment between the system and community partners. And last, we have our moderator, Lynette Greenhall, who is the Vice President of Education and Workforce with the Dallas Regional Chamber. Lynette coordinates the Chamber's public policy or public education policy efforts, supports various education initiatives, and serves as the Chamber's liaison with the Dallas Independent School District and other regional public health education entities. And so with that, I am actually going to pass it on over to Lynette and our esteemed panel to begin our conversation today.
Thank you, Crystal, very much. And I think we have one panelist, Dr. Shofu, who joined us at the last minute. So why don't you introduce her too? Crystal, you're on mute.
Thank you, Lynette. Thank you, Lynette. And Dr. Evelyn, thank you. Thank you so much for joining. And so Dr. Ashufu is a fourth-year general psychiatry resident at the University of Texas Southwestern in Dallas. She has spoken on panels and podcasts discussing topics surrounding mental health in minority populations, including barriers to treatment, health inequities, and stigma. So welcome, Evelyn. So glad you're able to join.
Great. So now we have a lot of issues to get started to really talk about today. So I think we're going to jump right into some meaty topics. So Ms. Shell, would you start us off and just talk a little bit about what are the behavioral and mental health challenges that our children and our families are facing in this pandemic?
Yeah, thank you very much for having me today. You know, when the quarantine, lockdown, whatever you call it, began last spring, we knew that there would be, you know, almost a second pandemic of behavioral health issues for our kiddos. They don't understand how this is going on. The parents didn't, adults don't. We don't know what's coming next, and they feel that too. So what happened last spring was, other than parents, children most often see their daycare school teachers, counselors at school, and their medical providers. And when people aren't going to those visits or aren't in school, behavioral health issues don't get identified. They're still occurring, they're just not being identified. So during the initial pandemic shutdown last spring, we had fewer referrals for behavioral health issues because people just weren't prioritizing that. But now that kids are back in school and resuming a partial normal life in terms of being out in school, we've had an influx of issues. The anxiety that adults feel, the stress that adults feel in perhaps losing a job, losing income, having loved ones get very sick, being worried about getting sick. Our kids feel all that too. So they have the same issues. The other thing is that we know with COVID, it has impacted our families of color and impoverished families more so than others. And so what happens is, if you're in a stressful environment, living in poverty, where you're struggling month to month, any additional stress on top of that just makes it worse. So those children are more susceptible to behavioral health issues, and it's depression, it's anxiety, and that can show up not in, you know, sadness or moods necessarily, but for young children, it's behavior changes. So you may think your child has behavioral problems or is just acting out, but really that's how they're showing their stress and emotional discomfort that we need to look for.
Thank you for helping us define that, because there are so many concerns and challenges that our parents and our caregivers have. Dr. Ashofu, would you talk a little bit about what the difference in the rates that we're seeing? How are we seeing those issues impacting our families and our children differently than we did in what we used to call normal times?
Absolutely, and thank you for having me. So, you know, what we're seeing is a pretty significant uptick in psychiatric or mental health symptoms since COVID has started. There have been multiple surveys that have been done, both in the United States and internationally as well, a few in China, that were specifically looking at what are the rates of anxiety symptoms, what are the rate of depressive symptoms, and then some other symptoms that don't really get talked about as much, but are definitely associated with mental health, such as poor appetite, insomnia, night disturbances. And what we've seen is that, specifically anxiety, with the most significant increase, there's been about a 20% increase internationally, with children between the ages of 10 and 18 who are experiencing what we would say more anxiety symptoms. So whether that be feelings of restlessness, feeling on edge, problems with concentrating, insomnia, things that are associated with increased levels of anxiety. And this is about on average a 20% increase compared to before the COVID pandemic began. We are also seeing not as huge, but also an increase in depressive symptoms. So just feelings of isolation, feeling sad, feeling down, feeling lonely. feelings of helplessness, feelings of hopelessness, as you can imagine. Those are symptoms that we've also seen have increased since the pandemic as well. And then, like I mentioned, not to as big of a degree, but we are seeing more children complain of difficulty with concentrating as well. We are seeing more children with more night disturbances, night terrors, nightmares. A lot more worried about either getting infected with the COVID-19 or a loved one getting infected, like a parent or caregiver. And so these are things that we're seeing at pretty significant rates compared to before the pandemic started. And so it's definitely something that's important to keep in mind as we're having discussions about what the impact of COVID-19 has had on our children and families.
Thank you. So Dr. Williams, as a pediatrician, let's bring you into this and talk about, what's the impact of these new mental health concerns and all these daily changes, and what is the impact on the physical aspect of our children and the physical well-being?
Yeah, we know, and we've always known that there's a strong connection between mental health and emotional health as well as our physical health. And this pandemic is wreaking havoc on not just on the ones infected with the disease, but just on us as a society and our physical health. And so one of the things that we're seeing is that just signs of stress that we talk about. And so we have to look at our own physical health, right, as parents. So our stress level can affect our, our blood pressure and the rate of headaches that we're having, but then also the ramifications of just not moving as much, right? I know for me, my hour-long commute ended with me walking up the stairs to go to my office, and then I would walk to different offices and meeting rooms and then seeing patients and all of that stuff. And now I'm not able to do that. And my watch has to remind me to get up and move because I have so many Zoom meetings that I go to during the day. But kids are having the exact same thing. They aren't walking or riding their bikes to school like they used to. They aren't playing outside. I'm fortunate enough to live in a neighborhood and on a street where there's tons of kids in my neighborhood and on my street. And every day I got to see them playing outside my window. I'm not seeing that anymore. Kids just aren't doing what kids do. And so with non-movement, we have to worry about some of the physical ramifications of that, not just our joints and our bones that aren't getting the exercise that they need, but weight gain. We've talked about the COVID-19. I know amongst moms, there's the joke about the COVID-19, like the freshman 15, that we put on weight because we're sitting around. Stress can lead to eating more and snacking more and eating or making unhealthy choices. But because we aren't moving, kids are also having the same thing. And the actual childhood obesity rate is expected to really skyrocket during this time. And some of the pediatricians are already marking that or noticing that in our kids. So, what this is going to do to us emotionally and mentally, it's something we have to talk about, but we also have to think about the physical ramifications as well.
Those are important things for our parents to remember and to understand. Stephanie, one of the hallmarks of the work that you do at Texans Care for Children is the advocacy piece and being engaged at the state level on what's good for the well-being of children. So are the mental health concerns of children at the top of the mind of our Texas leaders and our policymakers right now?
I don't necessarily get that sense. I think, and thank you for convening this panel. This is great. I know there's a lot of discussion around academic slide, right? They're calling it the COVID slide, where kids are. I have a 9-year-old. He's really struggling with remote learning and staying engaged. I know that's happening with a lot of kids. A lot of families are really struggling to oversee their child's education when they need to be working or looking for work. And so, I know that legislators are definitely concerned about the academic impact. And so one of our challenges and goals is really making the connection for them between mental health and access to services, family supports, family stress and anxiety and what that means for children's education. It's not just about whether they have broadband access. It's not just about whether they're remote or in the classroom or wearing masks or seeing their friends. It's also, it's really about how the child is feeling about themselves and whether they're feeling connected and getting access to, as Sue brought up, the adults that have often provided them support, whether it's a childcare educator or a teacher or a school counselor or, somebody like Dr. Evelyn, who they, might have an occasional appointment with. These are the adults and peers in their lives that they really need. I think it's really important as we talk about mental health and as families are sharing their stories, that we make sure to connect system issues like access to services and whether there's health coverage and all these policy type decisions that legislators are confronting, and make sure to elevate personal stories, but also put them in the context of what it is that school systems or mental health systems or our health systems could do to better support kids, because that's where the policymaker action comes into play. We have the lowest insured rate of children in the nation, the lowest insured rate of low-income adults in the nation. That is something that legislators can address. More mental health services in schools through funding or through a guidance and other connections between mental health service providers and school districts. Like, that's something the legislature can continue to work on. So my challenge is taking all this research and the information from families and communities and putting it in the context of legislators. If you care about this and you want your kids to do better in school and do better at home, this is what you can do to help out, not just, express sympathy or not just, do things that are a little bit, nice and sincere, but we really need them to take action.
I'm so glad that you mentioned that issue of access, because there was a report issued earlier this week, the 2021 State of Mental Health in America report that was issued, and it said that the Texas ranks 50th out of 51 in the overall access to mental health care. That obviously encompasses not only children, but families and adults, but certainly it's a critical issue that not only our policymakers and our leaders need to be aware of, but everyone, not all the way from parents to our medical profession. I think you all have done a really nice job of sort of framing what some of the issues are. And so I think what would be helpful now is for us to talk a little bit about some of those, maybe not necessarily solutions, but things that are practical things that can be put in place to address some of those things. So Sue, let's come back to you a little bit and talk about, what can the caregivers who help children do to help them? What can they do to help them develop resilience? And in the context of that, will you sort of define what you mean by resilience and what tactics that they can be using and what benefits our children can have by that?
Sure. So resilience is basically just how we adapt to stressors and life changes. And certainly the pandemic created a huge need for resilience in all of us, adults and children. So for example, a child that has a tremendous amount of stress in their life has trouble developing resilience because they don't have a consistent, nurturing, stable relationship. They don't have a predictable kind of routine. So what the pandemic did was changed everything. You're not going to school. There's no routine there. Mom, dad, caregivers are under tremendous stress trying to balance their work and childcare and education. So everything was in disarray. Resilience is how we adjust and move through that. And a child that has strong, nurturing relationships and some level of understanding and predictability does better with that. For example, the birthday party was canceled. All children are going to be upset about that. Some will move on very quickly, accept that, okay, well, I'll do this afternoon instead. Whereas other children, that birthday party really meant a lot to them. and they're not able to move forward. So as caregivers, we need to model that adaptation for them. We need to explain to them and show them in our own behavior that, well, we're not going to the birthday party, but now we have 2 hours free. Let's do something fun together. Let's go to the park and I'll push you on the swing. Or that's how we learn to bounce back, to move on to other things. And so to help develop resilience, you want to practice real life situations with your kids. So look at what their stressors are. If you know your child needs to have really quiet time when doing homework, then help them create that. Remind them, yesterday you got frustrated doing homework because it was noisy here in the kitchen. Why don't you go to your room and try to read your book there? Helping them to become adaptable and understand what their stressors are. And then, of course, the main issue in how to develop resilience is learning how to calm yourself down. We all get wrapped up in emotions. Kids that have more unstable, less predictable situations tend to have difficulty soothing themselves, even from a very young age. The best thing to do with that is deep breathing, meditation, mindfulness. Take a moment and teach your children that. Show them that, boy, I'm just really stressed right now. I can't concentrate on what I'm doing. Come sit with me for a minute and let's breathe together. And doing it yourself, teaching them how to do it, that's the best way to deal with stress and to develop resilience. And then helping them that when you're not able to think clearly, when you're feeling frustrated, overwhelmed, feel kind of stuck, like you can't move forward, take a minute and breathe. Feelings are never permanent. Don't talk about feelings like I am sad, I am angry. Say, I feel angry, I feel sad, because then you can change it and it doesn't define you. And that's what we have to do for ourselves, and then model that for our children.
Dr. Williams, I see you nodding in agreement to some of those things. Take that a step further and talk about what can the caregivers do to help their children and support them in their overall physical well-being related to, we talked about the emotional, but the physical aspect of it.
Yes, I completely agree with what Sue was saying about parents and modeling the behavior that they want to have for their kids, because we as parents are our kids' best example for that. And so one of the things that we need to do is to really be mindful of what we're portraying to our kids, right? We don't need to share too much about what's going on in the world and what's stressing us out, but we can share how we are dealing with those things. And so one of the things that I do, and I encourage some of my families to do, is to take kind of brain breaks throughout the day. And even when kids come home, or even if they're learning at home, but just say, you know what, I'm gonna stop my office hours. And I encourage families to do this with their kids. Let's keep separate times for school or learning, and there's time for fun and recreation as well. So go for walks as a family. Examine, go and visit a new park, get in the car and drive to a new area that you haven't had time to do before, and talk about the importance of physical health, because they need to hear about that. And then depending on how old your child is, they really need to take some responsibility for that. I have teenagers at home, and so I have 3 teenage girls, as a matter of fact. So it's very interesting trying to teach them something now, because they think they know everything. But one of the things we did early on when they were little was to always say, hey, we need a brain break during homework or just whatever we were doing. And so they would get up and I would turn on music for them to dance, or we might do yoga together or things like that. So encourage them to do that as well. And just be present. We talk about how the stresses of the world that we all hear, but kids don't need to watch the news like you do. They can't compartmentalize what they're hearing and seeing on on TV screen. So, keep that away from kids, depending on their age, right? It needs to be age appropriate, but that alone can cause some physical stress, and we can get tense. I catch myself just, especially during the elections, watching the news, I would feel myself getting tense just watching that. So kids don't need to witness that, and instead say, you know what, let's turn this off and let's color, or let's just do something fun together. And then the other thing I want to bring up is how important it is for us to keep structure. Like Sue mentioned, routine is really what helps all of us to feel stable. But that includes going to the dentist and going to your pediatrician or to your family doctor on your regular scheduled time. We've seen with the American Academy of Pediatrics has put out a report saying that lots of families have chosen or have missed out on their physical exams, on their annual physical exams and regular preventive health visits. That's something that we should not do, because we hear a lot about vaccinations and we don't want kids to miss their scheduled vaccinations. But there's so much more that goes into a health maintenance exam, including, checking on your developmental state, as well as how you're growing, how kids are eating in their diet. We ask about sleep habits. We talk about safety. All of those things are really important. And it ties back to the mental health, because that is where sometimes as a pediatrician, you pick up on things in the kids that the parents may not necessarily tie to emotional well-being. If the mom is telling you that, the child is eating more or having trouble sleeping, there may be something more there to talk about in terms of anxiety or depression or other mood disorders. So keeping those physical exam appointments with your primary care provider are so important to maintain both our physical and emotional health.
Thank you. That's great advice. Dr. Ashufu, let's talk about, we've spent talking now about children, and that's clearly our focus, but let's talk about the caregivers and the parents and the adults that are trying to take care of our children and address all these issues that have surfaced. What are some thoughts that you have or practical tips you can have about how those folks, the adults, can take care of themselves in order to help make sure that our children are staying as healthy as possible?
Absolutely. In all of the research that, has been done talking about mental health symptoms in children, a lot of it also makes sure to shed light on the fact that if parents and caregivers are themselves experiencing mental health symptoms, that will then transcend to the children. And, there's a correlation there. If parents are not taking care of their well-being, chances are that children will also be having some disruptions in their mental health as well. So I think it's very important to shed some light on how parents and caregivers can themselves maintain a good mental well-being. And honestly, it's very similar to the things that have already been discussed for children. Dr. Williams and Sue have already mentioned structure. Structure is also important for the parents too, making sure that you're putting yourself on a schedule, because a lot of things are being done virtually. It's easy to kind of let things sort of mash together, and then you lose that structure, which then kind of loses your sort of plan to attack the day. And so making sure that you're having that structure in place is one important thing. Also, physical activity is very important. Both for kids and adults as well, making sure that you are getting some sort of physical activity in as much as you can, whether it be going on a walk or any other sort of exercises or things that you'd be interested in doing. But just getting in some sort of activity will definitely boost those neurotransmitters that regulate your mood and kind of help you from kind of dipping into a place of feeling sad or maybe a little anxious. And then another thing, with the pandemic, there's a lot of uncertainty, and uncertainty definitely breeds anxiety. But I think it's important to sort of be aware of the things that are within your control and the things that are not within your control, right? And so, in your house, with your family, with your children, what are the things that you're actually able to have control over, and what can you do to control those things and to mitigate anxiety surrounding that? But then being okay with letting go of the things that you really cannot control, because there's so much uncertainty in the country, and that's okay. But I think it's the act of letting go and being okay and being all right with the fact that I don't know what next month or next year is going to look like. None of us do, you know? And so letting that go, letting that need to kind of have that control of knowing what's going to happen will be very important. And sleep is a really big thing, you know, making sure that you're getting enough sleep as a parent, you know, sleep hygiene, especially. So when you're going to sleep, turning off the TVs, getting off of social media, getting off of your phone, making sure that you're not like drinking too much water at night before you're going to sleep. So just practicing these habits. And the big thing is, as a parent or a caregiver, if you're practicing these habits, chances are your children are watching, and it goes back to kind of modeling the type of behavior you'd like to see in your children. They too will also do the same. And so making sure that you're not spending too much time watching the news or on your phone, and so that your kids are not doing the same thing. But these are some things that, you know, I can kind of go on and on about, like maybe journaling, meditation. Sue mentioned mindfulness. These are all great ways to mitigate anxiety, to mitigate depression. But then I do also want to mention that if you're assessing yourself and you're realizing like, man, you know, functionally, I'm not at the capacity that I need to be at. I'm having trouble at work. I'm having trouble with my children. I'm having trouble keeping up with my hygiene, you know, like the functionality has gotten worse, then it might be time to maybe seek out more professional help. And I think that's also something that's there. It's important to mention. You do not have to sort of suffer in that. And if the tips that I've given are not working, then it might be time to seek out a therapist or a psychiatrist like myself. And that's completely okay. And it will only help. And so I just wanted to make sure that I mentioned that as well.
Sure. Well, you've all talked about, and Stephanie, you brought it up, but you've all talked about one of the biggest challenges, one of the biggest stressors is the changing in school. And so let's go back and talk a little bit about, you know, the different school options. It's, you know, online, in person, hybrid. There's all these different kinds of aspects. Sue, why don't you talk a little bit about what is the impact of children on those changes related to school, and just kind of frame those so we can have a conversation about what to look at that aspect of it.
Yeah, and I too, my children are grown, and I can't tell you how many times over the last 9 months I've said, boy, am I glad my kids are older and I don't have to navigate this. So I feel for everyone who has young children and school-age children. But I always say, you know, the good news, bad news is there's no wrong answer. But then there's no right answer either. There's no evidence or set decision on you should send your kids to school. No, you should keep them virtual. Every family has to navigate their own risks with health exposure and their own circumstances to figure out what's best for their family. But the bottom line is, whatever you decide is best for your family is indeed what is best for your family. So whether that's keeping them home and having virtual learning, people have created little pods of learning, so they have a small group with limited exposure and virtual learning. Others are going to school and the kids are learning to wear masks and how to adapt to that. They all have their pros and cons. So it's a matter of what works for your particular situation, given your family. But there's so much more we can do. So we need to recognize that no matter what learning option you take, it's not the same as it always was. It's a very different experience for your child. So I think we need to create our own ways to augment their learning. You know, there are so many things, educational channels and videos that you can watch about the environment, animals, space, math games, all kinds of things that you can do that are free and online to help supplement your child's learning. And finding ways for them, as Dr. Williams said, to get outdoors, to exercise in safe, socially distant ways, you know, helping them find a small group where you like the parents and they like the kids, and and you can wear masks and go to the playground at the same time and have some social time. You know, those are all the things that we need to look at, and creating new interests for your kids. You know, find things that you can do, walking around a park, looking at leaves, planting a garden. A lot of people, you know, put a few plants in the spring that they had never done before. Those are all educational and nurturing activities for your kids that we now have perhaps more time to support than we did when they were in school full time and soccer practice and full-time work and overtime work. You know, so find ways to take the change and identify new things that you can do as a family that will help support your child. And then just keep talking with them about the fact that things are different and helping to build that resilience by showing them other ways to do things and how to handle things. My one hope with all of this, I tend to try to find a silver lining if I can, but my hope of all this, and one of the good things, is that we are all talking about behavioral health now, more so than we ever have been. There still is a stigma for somebody to say, you know, I'm clinically depressed and I need medication and I have to see my therapist. People just still don't talk about that like we would if we said, oh, you know, my aunt has cancer. We talk about that and get support for that. We need to do that with behavioral health too. So my silver lining is that this has highlighted the impact of environmental stress on our overall emotional and physical well-being, and that it's bringing behavioral health care into the light. Ultimately, behavioral health care should be a part of everyday health care. Every physical exam physician should be saying to adults and children, how are you feeling? What's changed? Do you have a lot of stress? Anything going on that's causing you difficulty when you think about things, or how you're feeling? That should be a part of our regular health care so that we can identify things and treat them. Because when we do see things early on, it's all very, very treatable. And that's my goal in all of this, is to keep the spotlight on it.
Thank you. That's Dr. Williams. I think one of the top of the mind questions that almost all parents have, and at all ages, is this question about screen time and how much is too much, and what is going to be the long-term impact on our children, if any. Can you address that and give our parents some ways to think about that aspect?
Yeah, and unfortunately, I think it just remains to be seen. We have long seen the correlation between excessive screen time and many negative effects of it. You know, the American Academy of Pediatrics has recommended for years that children only receive about 2 hours of screen time in a day, and less than that for under 2 years of age. But what happens when school is on a screen, right? And then after that, kids want to get back to their video games or their TV shows. And even us as adults, we're spending a lot more time in front of screens as well. So some of the things we talked about that have come along with this pandemic are still true when it comes to just excessive screen time, that being non-movement and the ramifications of that. So the fear that we could have more obesity and weight gain, excessive weight gain during this time, and then the ramifications or the sequela of that. So more type 2 diabetes, more hypertension, more high cholesterol. All of those things are really from poor diet, but also from inactivity, just not moving. And then there is also a correlation between too much screen time and hyperactivity or poor attention or inattentiveness. And so I think that ADHD and those kids who are already diagnosed with ADHD may see an increase in symptoms. I saw a mom put on her social media that she had to apologize for to the teachers because she had no idea how hard it was for the teachers to teach her son, because she got to see firsthand what it was like to try to keep him still and sitting in front of a screen all this time. And so we have to really be vigilant in looking at things like that. And then again, that healthy eating, mindless snacking. I am guilty of that as well, but it kind of goes back to parents really being in charge of what comes into the house, but keeping healthy snacks like, vegetable sticks, carrot sticks and celery and grapes and fruit, things like that, what that kids can snack on to kind of prevent some of the poor choices that we can make when it comes to snacks. And then something else we don't talk too much about is dehydration. Some kids who are sitting there, whether it be for learning or video games, aren't taking breaks to just drink water and get up and go to the restroom. So we need to be mindful of that as well. Keep water bottles nearby that are refillable, that kids can just get swigs of water throughout the day. And again, going back to that routine, when my kids were younger, I would set a timer to say how long they could either watch TV or be on their screens. You can do the same thing now because routine is really important for us to kind of keep our own mental stability as well.
Those are all great tips. Thank you. So, Stephanie, we have a question in our chat from one of our listeners that is policy related that I would like for you to tackle. The question says, Texas and Oklahoma rank the highest in uninsured children and the lowest in Medicaid reimbursement for behavioral health services nationally, which obviously exacerbates these issues. Are school leaders working with legislature to help providers fast track enrollment in Medicaid for providers wanting to render services on school campuses? And they go on to say it takes about 6 months to make that happen. But that whole issue of dealing with the policy aspect of Medicaid and people working together.
So that is a great question. Our challenges are that, it varies, right? Some schools make it a priority to try to help families, kids enroll in health coverage if they know that, a child does not have coverage, but schools have a lot on their plates right now. And it's sort of a question. I don't know the answer about whether schools are putting as much staff effort into that. And again, it may vary. At the same time, the state has proposed cuts to its outreach and enrollment efforts around Medicaid. So we're sort of going backwards right at a time when more kids, more parents need health coverage. Lots of parents who had jobs that have health coverage, who might have lost their jobs, lost their health coverage too. And that's really increased our uninsured rate. So, it's important, again, to talk about the system type things, the policy changes that policymakers can address, and health coverage is a big, important one. And funding outreach and enrollment efforts is another one. And then on the children's health front, on the children's coverage front, one thing we've been trying to fix is that for many years now in Texas, and we don't have to do this, but Texas has routinely kicked kids out of children's Medicaid if their parents don't send a form back within 10 days. And there's very, very frequent income checks, like at 5 months, 6 months, 8 months, 9 months. Most states go by, once you're eligible for Medicaid, you can be enrolled for the full year. And you don't have to do paperwork and have your income checked for a full year, which is how we do it in our CHIP health insurance program. So we've been trying to get legislators to make Medicaid just a full 12-month continuous enrollment, and therefore taking that bureaucratic paperwork challenge out, get rid of it altogether. It's not helping families and it's not helping kids, and it's certainly not going to help, our teachers and school environments when kids aren't getting the help they need. So that's something else. That's a bill that will be reintroduced again this year, the continuous children's Medicaid bill. And so we're hoping that we can get that passed this year. The last thing I would say is that, on the piece about connections and talking to teachers and talking to pediatricians, and there was also a really good question in the chat, and hopefully our pediatrician colleague can address this too, is this question about what behavioral issues look like for pre-K kids and younger children in childcare settings. And we've always had behavioral challenges in those early years based on family trauma or, lack of experience in early childhood education and sort of more formal learning settings. And clearly, that can sometimes turn into outbursts of, behavior or a child isolating and not interacting well with peers. And one thing we're really concerned about is what we don't want to have happen is for kids to be kicked out of their early learning environment where they really need to be right now for that structure and support. And so again, this is a really important time for early educators and the system that supports them to make sure that they have the tools and training they need to identify these sorts of needs in children and what to do about them in a very positive and supportive way, rather than just calling the parent and saying, like, you have to pick your child up and don't bring them back, because that's really not helping the child at all, right at a time when they really need to be getting positive early childhood experiences. So I'll kind of punt over to the pediatrician for more information about what to look for that younger child. But I think if they can learn those skills before they're age 5, like that will carry that kind of resilience will carry on forever.
I think that's a great point. We had actually talked about this earlier as a question that we wanted to address. So Dr. Williams and Dr. Ashofi, let's kind of combine this in together from the actual medical perspective of, what are those behaviors that parents need to look for and identify that signify that there is a definite mental health issue versus just the day-to-day frustration of this is the way kids act and it's okay. How do parents know when they've risen to a critical level and they need to seek outside help or some kind of effort for their children?
Yeah, it's such a great question. And it's so, it can be difficult with kids. And I noticed in the question from Mrs. Johnson, hi, Mrs. Johnson, that she said from 6 months to 5 years. And what's interesting is that we talk about some of the kind of mood disorders or behavior disorders once kids are school age, but we've known for a long time, and I know Dr. Evelyn can talk about this, that those things tend to show up much earlier in early childhood. And so being attuned to that is so important. And so I'm so thankful for this question. But one of the biggest clues that kids give us is really just a change in behavior. So the kid who is normally rambunctious and playful and happy is all of a sudden sullen and doesn't want to play with anyone. Or a kid who normally has a great appetite and isn't eating anymore, or isn't eating as normal. Just subtle changes sometimes can be cause for concerns. And that's where it's really important for us as trusted adults to really be key in on those types of signs. Look at their sleep patterns. Are they sleeping more? Are they sleeping less? Are they more or less active than they typically are? And then talk to them. Ask them about it. A lot of times kids can't verbalize exactly what they're feeling or why they are feeling that way, but sometimes they can tell you that they are feeling sad, or, even young kids can worry about whether or not bills are getting paid if they see mom or dad really frustrated or afraid about what's going on. So from the pediatrician standpoint, is really just an adult standpoint, is look for those changes in behavior that kids are having and really talk about those things with the kids and talk with their families. For the early childhood director, talk to the family and see, are you noticing this as well? We noticed that he's fighting more and he typically doesn't do that, or, he's more quiet than he typically is. Talk about that with other people, because sometimes, parents may or may not pick up on it, but then that can really open their eyes to see or to notice those subtle changes in the child's behavior.
Dr. Ashofi, do you have something to add to that? And Sue, if you have anything to follow up, we can add that.
Yeah, I just, wanted to say I completely agree with Dr. Williams. Like the change is going to be important. It's in younger kids, a lot of times if they're feeling more anxious, what we tend to see as far as trends is like maybe increased irritability. So like they're not going to be able to say like, I feel anxious, I feel worried, but they might get a lot more irritable. Their mood might change. They might be a lot more clingy. Maybe they're not, a child who's typically pretty confident and able to like go out and and hang out with friends. Maybe they're a lot more clingy to their parents because of the worry. They're not wanting to leave the house. So these are just some trends, but like Dr. Williams has mentioned, change is really going to be the most important factor. And if you've seen like a change in your child's behavior, in your child's like mental ability as well, like if they're becoming a lot more inattentive, that can be a sign too. So if they're a lot more forgetful, if they're a lot more like not paying attention to simple details, doing things that they usually would not do, that might also be a clue to key you in. And then as far as like, when does it become a point to where you should like seek out help, or, like versus is this just a day-to-day? I think, again, it's like talking to the child. I think it's been well established, and we know here that the pandemic has absolutely affected children of all ages. And so it would be important to inquire about that, like they are, no matter how young they are, it's as young as 3 years old. We're seeing that this pandemic is affecting children in some negative ways. And so it'd be great to just talk to your children and at an age appropriate level, of course, but, don't be afraid to ask them about how they're feeling with everything going on, or just how they're feeling in general, because I think you'd be surprised at what sort of responses you may get from them that can really help guide and direct your next course of action if it's something that's a lot more serious, like affecting their grades, affecting their their weight because they're not eating, they're not sleeping. When it becomes a little bit more severe symptoms, that might be time to go ahead and seek out help. But it'll be important to really ask and inquire with your children to get a good sense of where they may be at. So
I would add to that, not just dealing with the symptoms, behaviors that occur, but trying to be proactive in talking about behavioral health is also about talking about social emotional learning and creating an environment where we're teaching our children, modeling it ourselves by talking about feelings, by solving problems, by talking about conflict. And you can do that in preschool, in every age range as age appropriate. That, in preschool, if two kids want the same toy activity at the same time, how do you solve that together to share? Well, let's let him have it for 10 minutes and then you can have it for 10 minutes. That's all social emotional learning and problem solving that teaching our kids early on helps them to then better understand and cope with their emotions. That when I get frustrated, when I get angry, when I feel sad, when I feel like I just don't want to do anything, what does that really mean? And how can we work through that? I think this is another opportunity for that kind of growth in our community organizations to just include behavioral health, social, emotional activities development in our curriculums.
Thank you. We have just a few minutes left, but Stephanie, I want you to go back real quickly to getting ready to go into the legislative session, and what are those key issues that need to be top of mind of our legislators and that parents should be advocating for, knowing that we need to address these with the legislature.
Yeah, so broadly, we're really sticking to, 4 main points that we're hammering home that cross a lot of children's issues, including mental health, which is the first one is, the goal of legislators in this next session has to be about helping Texans through the pandemic, and that's not just how to distribute the vaccine. This is things like helping to address mental health, helping to address health coverage, all these challenges that parents and kids are facing. The other thing, we want to hammer home is that many of these challenges, in fact, almost all of them pre-existed COVID. So it's not like they're going to disappear once the vaccine gets out and people start to take it. And especially with mental health, these could, as our experts said, these could have long-term ramifications for kids. So in terms of some policy goals, I talked about some coverage, access to services. There's also, many healthcare providers have gone to telehealth, and families have really appreciated that. And we want that flexibility to continue, so that, you know, providers and parents can choose that option, especially in rural communities, but even in urban ones. And so that's really important. We are also talking a lot about, in a whole range of issues, the need to address disparities and racial inequities. And that comes up in terms of, you know, the quality of our education environments, access to, you know, services and coverage, all these things. So we are talking about this in terms of addressing racial justice issues, because there is interest in doing that. And then the last thing is, yes, we have a bad economy right now. We don't have enough revenue to pay for everything that legislators and all Texans might want to do, but we are very, very vocal that this is not the time to make cuts to programs, to schools, to, you know, health services. In fact, this is probably the time to enhance support for them, because families and kids need so much more. So it's easy to say, oh, I know we're in a bad economy, we're going to have to suffer some budget cuts. Well, the truth is the state actually has a lot of money in its piggy bank, and we are expecting more federal support to come down to Texas, and there's other revenue options available to our policy leaders. So, you know, if anyone is talking to their community leaders, or sending an email to a policymaker, or, you know, making a phone call, you know, we need to these services for kids and families to be fully funded. Make it happen. Like that's the broad message, because the needs of kids and families are so much tougher right now, and we can't walk back our support for them.
Thank you. Thank you all so much. This has been a really quick conversation, and we've had a lot of topics. We didn't get to everything we wanted to talk about, but great information. I know we're close to the end of our time, as I said, and if our listeners can just hang with us for like 5 more minutes before we go, one of the things we want to do is leave you with some resources to sort of address some of the issues. And so I want to introduce Taryn Sanchez, who is from OK to Say, who's going to talk a little bit about the resources. And Taryn, if you can weave into your answer, one of the questions we got was if there's any opportunity for support groups for the caregivers, those caregivers who maybe don't have family or single parents. If you could add that to what your resources, we'd appreciate you addressing that. Again, thank you to our panelists. This has been a great conversation. Taryn?
Hi, everyone. Thank you. And yes, OK to Say is a public awareness campaign initiated by the Meadows Mental Health Policy Institute with a simple message. It's OK to talk about mental health. And Sue Schell beautifully said earlier today that the silver lining of the pandemic is that it's helped bring conversations about mental health to the forefront. So we really appreciate the opportunity to be a part of this conversation today with the Boys and Girls Club of Greater Dallas, and thank you to our amazing moderator and panelist. And I'm not sure, are the resources being projected right now? I'm not able to quite see the screen.
Ah, there they are for you.
Amazing. Okay, awesome. Yes, and then you know, we're happy to provide some resources at in our Facebook event, and up here, I'd like to highlight our OK to Say page. Features recommended books for children and teens, and to help explore topics around mental health. We have a number of other organizations listed that have incredibly valuable resources. The Children's Health website offers many articles around a variety of topics to support family wellness. The Grant Halliburton Foundation, and specific to those support groups, they offer a number of support groups for children's and teens and parents. They also offer the Here for Texas navigation line, which is a free helpline offering guidance and information and mental health support that's open Monday through Friday from 10 a.m. to 6 p.m. And so, and then also NAMI North Texas has a number of different support groups that available to all different types of populations. So we encourage you to check out those resources, and we can post these in the Facebook event, and also hope to provide a follow-up email with the hyperlinks. But we really appreciate everyone who attended today, and we hope you found the information we shared today valuable, and thank you, and hope you all have a happy holidays.
Terrific. Thank
Lynette.
you. Yes, thank you all very much. We appreciate the opportunity to share this information and hope that it's given you a little bit of peace and comfort as we move through these this incredibly difficult time going forward.